Thank you for your interest in the Rural Health Clinic program. You've accessed Part 4 of the 4-part session entitled Medicare Billing for Rural Health Clinics. Medicare payment for RHC services session is designed for individuals who may not be familiar with the Rural Health Clinic program. For additional information about the RHC program, please access Parts 1 through 3 of Medicare Billing for Rural Health Clinics, as well as other focused educational Rural Health Clinic webinars sponsored by the Wisconsin Office of Rural Health. So, let's talk about Medicare payment for RHC services. How are RHCs paid? RHC services are reimbursed by Medicare under an all-inclusive payment rate per visit, regardless of the type of practitioner. So it does not matter if it is a physician, a physician assistant, a nurse practitioner, a nurse midwife. For the complexity of services, they are all paid as an all-inclusive rate, the same payment. A 99212 versus a 99215 with surgical procedures will be paid the same all-inclusive rate. Wisconsin Medicaid reimburses RHCs on a fee-for-service basis with an annual cost settlement. So you will receive the payment rate from the Medicaid schedule until you file your cost report, which at that time, that annual cost report will settle the difference with Wisconsin Medicaid for that fee-for-service versus the cost. Each RHC has an interim rate. If you are an individual RHC, you will be receiving a capped rate. These rates, this all-inclusive rate per visit, is based on the cost report. And each year, that rate will change. It's established by a Medicare Administrative Contractor, your FI, and as they go through the cost report, you will receive that rate. It's determined by dividing the total allowable cost by the number of total visits for RHC services. So these total visits that you claim on your cost report are very important. If they are inflated, you are going to be receiving less than what you should. You can adjust that rate during the reporting period. So if you are a December 31st year-end, that rate can change anywhere from, between January 1 and December 31st by sending in an interim cost report. For freestanding RHCs, the upper payment limit for the calendar year 2018 is $83.45. This is the maximum that you would receive, less the copay and deductible. There is no upper payment limit for RHCs that are provider-based to a hospital with less than 50 beds. So if you are a provider-based RHC to a critical access hospital or another hospital with less than 50 beds, you will receive your actual cost. The coinsurance. If the item is covered under the RHC benefit, the beneficiary has to pay 20% of the charge. So if you charge $100 for that visit, the patient will pay $20. even though Medicare only will give you $70. The patient is paying 20% of the charge. If the service is not covered under the RHC benefit and is covered under Part B, the beneficiary pays 20% of the Medicare approved charge according to the Medicare physician fee schedule. Such things as, the diagnostic services that are performed in the clinic, such as radiology. The patient would only have to pay 20% of the Medicare physician fee schedule. But if it's an E&M service, they're coming in for a visit, it qualifies as an RHC visit, then they have to pay 20% of the total charge. Payment examples. Customary charge for a 99213, say, is $120. Medicare allowable is $70. Okay? The Medicare encounter rate is $160. Okay? This $160 is limited to $80 for independent RHCs. And there is no limit for provider-based less than 50 beds. So we're going to assume that deductibles have been met. So in an independent, you're going to charge $120. Patient has to pay $24 because remember, that's 20% of the charge. Medicare will pay $64 because they are paying $70 less than 20%. So the total payment is $88, and you have a contractual adjustment of $32. Now, in a provider base with less than 50 beds, same scenario. The customary charge is the $120. The patient pays the $24, which is 20% of the $120. Medicare is going to pay them $128. And why is that? Because as we said here, the Medicare encounter rate is $160. $160 less the $32 or 20% copay is what Medicare pays, $128. So they actually will receive $152. And in this case, they will have a negative $32 contractual adjustment. They are receiving $32 more than what they charged. Part B, if you have just a freestanding clinic, not an RHC, same scenario. $120 charge, patient copay is only $14. Reason being, the Medicare physician fee schedule, from what we said here, the allowable amount is $70. So the 20% is $14. Medicare, again, will pay $56, and the total payment for is $70. So a freestanding clinic, not an RHC, is going to have a $50 adjustment. As you can see, in this particular scenario, the provider base has that negative $32. They're actually receiving more than the charge. This is not always the case, but in this particular one, that negative $32 should be recorded as the adjustment. One of the questions we often get is, does it matter how we code a visit? Because we're always paid the same rate. We're always going to get that $82 or that $160. Does it matter? And it does matter. And as you can see at the bottom, it's got a big exclamation point behind it. because Medicare considers overcoding a violation of fraud and abuse. And because of this, you do not want to be caught in that situation. They also consider undercoding a violation of fraud and abuse regulations, because in those cases it encourages patients to overuse the clinic. So both of these situations, no matter if you overcode or undercode, it does matter. Also, when your charges are sent out, remember the patient is paying 20% of that charge. The charge for a 99213 is normally less than a charge for a 99215. And that patient has to pay the copay, the 20% of your charge. So it is a violation of Medicare, and it also does mean something to your patient. Thank you again for your interest in the Rural Health Clinic program. You have participated in Part 4 of the 4-part session entitled Medicare Billing for Rural Health Clinics. For additional information about the RHC program, please access Parts 1 through 3 of Medicare Billing for Rural Health Clinics, as well as other focused educational rural health clinic webinars sponsored by the Wisconsin Office of Rural Health.